A CT scan is an X-ray procedure that creates cross-sectional images with the help of computer processing. CT images are more detailed than conventional X-ray images and can reveal bones as well as soft tissue and organs. A conventional X-ray uses a fixed tube that sends X-rays in only one direction, while a CT scanner uses a motorized X-ray source that shoots narrow beams of X-rays as it rotates around the patient. There are special digital X-ray detectors located directly opposite the X-ray source. As the X-ray passes through the patient, they are picked up by the detectors and transmitted to a computer. Image slices can either be displayed individually in two-dimensional form or stacked together to generate a three-dimensional image that can reveal abnormal structures or help the physician plan and monitor treatments.
Hello, and thank you for choosing Cedars-Sinai. Your doctor has ordered a CT scan for you. This video will let you know what to expect and how to get ready for your exam. A CT scan is about as safe as an ordinary X-ray. You will be exposed to a small amount of radiation, but it will not hurt you. The information a CT scan gives to your doctor far outweighs this small exposure to radiation. Most CT scans do not need any preparations, but there are a few exceptions. For example, if you are having a CT scan of the colon, abdomen, or pelvic area, you will need to prepare for the scan before it can be done. You will be given a special liquid to drink in your hospital room about an hour before the exam. This drink is called an oral contrast. Drinking this liquid helps to see inside your body on the scan. You will not be able to drink any other liquids 3 hours before your exam. Your doctor or nurse will let you know in advance if you need to make any special preparations. Now let's take a look at what you can expect during your CT scan. Your CT scan will be done at the Taper Imaging Department, here at Cedars-Sinai. About 30 minutes before your CT scan, a transporter will come to your room to take you to imaging. If you can, you should go to the restroom before you leave your room. Any devices used for your care, such as an IV, heart monitor, and oxygen, will either be supplied or be brought with you. A family member or friend can come with you, but must stay in the imaging waiting area until your exam is done. The transporter will check you in at the pre-scan area. For your safety, you will be asked the same questions a few times by different members of the imaging staff. Patients with heart monitors will still be monitored. We will give you a call light in case you need help. We do many types of scans and imaging, and you may see people come after you and leave before you. Don't worry, we didn't forget about you. These patients may be having an imaging procedure that is different from yours, or it may be an emergency situation. We will do our best to keep you from waiting, but delays can happen. A member of the imaging staff will move you to the CT room when your room is ready. Your CT technologist will ask you a few questions to make sure that you get the right scan and that you are safe during your exam. The technologist will go to another room to conduct the exam. They will be able to see and hear you and will be able to enter the room if you need help. You will also be able to talk to the technologist through an intercom.
Okay, Carlos, I just want to make sure that you can hear me okay. If you could give me a wave with your hand, please. All right, we're ready to begin.
The CT scanner looks like a large donut. You will lie on a table that will slide you through the middle, and the scanner will create images of your body. To get a clear picture of other areas of your body, the technologist may inject a contrast dye by IV while you are on the scanner. Some people experience a metallic taste in their mouth, but this only lasts as long as the injection. If you are allergic to iodine, there is an additional preparatory step, and your nurse or doctor will explain this to you. Your scan will last 10 to 20 minutes. Your technologist is not able to give you results. Your images will be read by a specialized imaging doctor called a radiologist. The information from the CT scan will be quickly sent to the doctor who ordered the test. The doctor will talk to you about the test results and your treatment options. After your CT scan, you will be moved first to the post-scan area, and then the transporter will return you to your room. We hope this video has been helpful to you. If you have any other questions, please ask a member of the imaging team. Thanks for watching.
I'm Angie, and your doctor has ordered an MRI, and I'm here to show you exactly what the MRI machine looks like and what it does. What it does is a big camera that takes a picture of the inside of your body. How it works is you will lay on the table, and the bed will move up, and it will go in and it will take pictures just like you would with a normal camera. It just looks a little bit different. Once you're in the camera, it doesn't hurt, it doesn't spin around on you, or it doesn't close in. All it does is make a really loud noise, and that noise does not hurt. It's just very loud. So a lot of the time the kids will listen to music or put headphones on, and this is what these look like. And I want to show you on a little model. So this is kind of how the machine works. We shrunk it down to show you exactly that you will lay on the bed. There will be a place there for your head, and you will lay right there. And the bed does move, and it will move into the camera, but your whole body will not go all the way in. And it does not close. It does not have any doors. You can see all the way through it. This part of the camera also does not move. Nothing spins around. All it does is make really loud noises. And again, the ladies will let you wear headphones or listen to music. When you're in here, you will always hear a little bit of a sound. Some kids like to say that it sounds like a bird chirping or like a car humming, and that is normal. If the doctor has ordered to get a picture of your brain to look at the inside of your head, this is part of the camera also, and it will slide over your head. It kind of looks like an astronaut helmet, or it looks like a football helmet. And it does not touch you. It just goes on the outside of the pillow that you will already be laying in. And when you're lying there, there's a mirror here. So you will be able to see whoever is with you by just looking up with your eyes. We don't want you to move side to side or up and down. If you move while you're in the camera, it will become blurry just like a normal camera would. So you can look with your eyes and see whoever is standing out here so that you're not alone. And if you choose not to listen to music or to have the headphones in, they also might use little pillows like this, and they go right next to your head. They're nice and squishy, and that just makes you more comfy and also makes it harder for you to move your head. Because again, your job is to lay very still, as still as you can, without moving your head around so the pictures are not blurry. And now we're going to show you exactly how the bed works and what sound that the camera makes so that you're not afraid of it. So the patient will lay on the table, and there's a nice soft spot for the head, and we'll make you as comfortable. If you would like a blanket, we can do that. We put a pillow under the legs just so you're more comfortable. And these are the headphones I was talking about. You can either listen to music or just have the headphones on. That also helps your head not wiggle around, so again, we don't have blurry pictures. So the table's going to go up. It's kind of like a little elevator. And then next, the helmet will come down, like the astronaut helmet that we talked about. And you will see that it does not squish her. And then next, the helmet will come down, and that is part of the camera as well. Looks like an astronaut helmet like we talked about. It does not touch your head and does not squish anything. And you have the mirror there where you can look straight up with your eyeballs and see anybody who is out here with you. And then the bed will go in, and that moves a little bit, and that is the only part once you're here that moves. And once you are in position, the camera will start working, and it is very loud, and that's why you have the headphones or the music on. A lot of the kids like to say that it sounds like a construction site, there's hammering, jackhammer, or like a rocket ship going into space. It's very loud, but again, it will not touch you, and it does not spin around, and it will not hurt when you're getting your pictures taken. So you hear different knocking sounds. The camera makes all sorts of different noises. Not all of them are the same. And again, that's just the camera taking pictures. She's fine in there. She can see me in the mirror, and she's doing great. If your loved one was with you, they can touch you and make sure that they know that you're there. And that is what one of the sounds like. Just taking pictures and just laying there super still. I just want to remind you again, when you're inside the MRI scanner and it's taking pictures, be as still as you possibly can so that we can get the best pictures and the doctors can find out what's wrong. And if you have any further questions about the test, please ask your nurse.
We're going to show you how easy it is to take a digital panoramic X-ray. First, we have the patient bite on this little white tab. And then we press this against their forehead, and then we tighten the sides in, just so we're nice and centered in the machine. And then we shine a little red light down the center of the nose. We want to make sure that's centered so we can get the correct X-ray centered. Once that's centered, we have the patient put their lips around the white piece that they're biting on. They bring their tongue to the roof of their mouth, and then their only job is to stay nice and still. The digital panoramic X-ray is going to rotate around the head. It takes about 12 seconds to complete. The patient just has to stay nice and still until it is complete. And then we're done. How was that, Marissa?
A bone density scan is both non-invasive and pain-free. This test determines the strength of your bones by measuring the grams of calcium and other bone minerals. This test will report the likelihood of developing osteoporosis, a disease of fragile and weak bones, and occasionally even find osteoporosis-related fractures that have already occurred. A bone density scan requires minimal preparation. Avoid wearing jewelry or any other metallic objects on your body on the day of the test, including any clothing with metal clips, snaps, buttons, or zippers. During a bone density scan, you may be asked to wear a paper gown. An X-ray machine will scan those areas where bone degradation is most commonly found, including the back and hips, with minimal physical contact. Once the test is complete, you will be able to return to your regular, normal activities. At CML Healthcare, we strive to deliver the highest quality medical diagnostic results in the most professional and efficient manner. A mammogram is a non-invasive X-ray procedure that plays an essential role in the early detection and screening of breast cancer. On the day of your test, avoid wearing lotion or deodorant on the skin, especially around the breast area. To ensure the best quality image, you may be asked to clean any foreign material off your skin before the examination. If you're experiencing breast tenderness due to menstruation, you may wish to reschedule. It is also very important to tell your physician and technologist if you have breast implants. Prior to the mammogram, you will be asked to remove all jewelry and metal objects. You will also be asked to remove clothing above the waist and wear a paper gown. The images are taken in an upright position with one breast at a time being placed between two X-ray plates. The plates are gradually positioned to compress breast tissue, which ensures the best quality image. Once in place, two images are taken of each breast, one from top to bottom, the other from side to side. Once the test is complete, your breast may be tender temporarily. However, you'll be able to return to your regular activities. At CML Healthcare, we strive to deliver the highest quality medical diagnostic results in the most professional and efficient manner. An ultrasound is non-invasive and pain-free. This test exposes a specific part of the body to high-frequency sound waves that produce real-time images. Ultrasounds are most commonly associated with pregnancy, but are also useful in examining sports injuries and various cancers. There are a wide variety of ultrasound tests with different ways to prepare. Some require you to drink a large amount of water prior to the test. For others, you must not eat or drink for a certain number of hours before the test. Some require no preparation at all. Be sure to consult your physician or the clinic to get the specific instructions for your particular test well in advance so you can properly prepare. An ultrasound may require you to remove articles of clothing, and you may be asked to put on a paper gown. The technician will place a lubricating gel onto the area being examined and will use a device called a transducer to make contact with your skin. For some ultrasound tests, the transducer is attached to a probe and inserted into a natural opening in the body. Once the test is complete, the gel is easily wiped away and you will be able to return to your regular activities. At CML Healthcare, we strive to deliver the highest quality medical diagnostic results in the most professional and efficient manner. X-rays are a non-invasive and pain-free method of diagnostic imaging that are used to clearly view internal structures of the body. X-rays are commonly used to detect bone fractures, pneumonia, and kidney stones. There is no physical preparation for a general X-ray test. However, you should avoid wearing jewelry or clothing with metallic items, including metal clips, snaps, buttons, and zippers. You may be asked to remove articles of clothing and put on a paper gown. During the X-ray, you will be asked to remain completely still while the test is being performed. The test itself is quick and usually lasts for only a few seconds to a few minutes, depending on the number of images required. Once the X-ray is complete, you may be asked to remain at the facility in case more images are required. At CML Healthcare, we strive to deliver the highest quality medical diagnostic results in the most professional and efficient manner.
I think it can be confusing. We get a lot of questions every day. CT is, in layman's terms, an X-ray machine hooked up to a computer. When we are scanning the patient, we lay the patient flat on the table. CT uses a thin, pencil-thin beam to take cross-sectional images of the patient's body. The beam rotates around the patient's body, and we slice the patient's body like a loaf of bread. That's how CT scans. It's utilizing radiation to take the images. It needs to be quick because in this day and age, of course, the biggest concern that we have being in imaging and radiology is to keep the doses as low and as safe as possible, but still give us that good quality diagnostic study. MRI stands for magnetic resonance imaging. MRI images the water molecules in the body, and it does that with a very strong magnetic field, which is the big cylindrical tube. That's the magnetic field in there. So if the patient were to lay down on the table right now, we would place their shoulder into that coil, and between the radio frequency, the strong magnetic field, and the coil, which acts as an antenna, we are going to produce images of the soft tissue and the bone with MRI. I think that's one of the things that patients get the most confused on. You know, a typical MRI is going to take at least 30 minutes. A CT scan is typically 5 minutes. CT is going to be excellent for the organs in the body. It's going to be excellent for bony detail. MRI, on the other hand, uses no radiation at all. It's using a strong magnetic field and radio frequency. Its specialty is soft tissue. I would definitely send them to CDI. I would send them there because I know what kind of quality scan they're going to get, and the radiologist reading it on the other end is very good at what they do, and so I just don't know how you could get any